Medicare annual enrollment period is open, but what does that mean for you and your health care coverage? Todd Carlson with United Healthcare joins us now to help Medicare eligibles understand their choices and their options in selecting a Medicare Advantage plan during the annual enrollment period. Great to see you, Todd. All right, so tell us about the annual enrollment period. What is it? Why is it so important?
Absolutely. So your annual enrollment period starts October 15th and runs through December 7th. So if you're already on a Medicare plan, that gives you an opportunity to really compare plans, look at the changes to your current plan, and really make sure that you're making a good choice for the following year. If you're new to Medicare, then there's a 7-month window that you can get signed up, and it's all based around your birth month. So the month that you turn 65, you've got the 3 months before that 65th birthday and then 3 months after the 65th birthday, so that you can get signed into whatever type of Medicare plan you would like.
Okay, so no surprise, navigating insurance can be a little intimidating.
Yep.
So what are some things that people should really be focusing on when they're looking at the right Medicare plan for them?
Absolutely. So Medicare is definitely not a one-size-fits-all. So there's really some key points that we suggest you look at when you're choosing a Medicare plan. One would be your current plan that you have today. So plans change every year. So you want to look at your current plan. Is it working well for you? Is everything covered that you need to be covered? Right now, you should have already received a document called an annual notice of change, and that will give you the changes to your plan for the following year. So that's something you really want to watch for in the mail and go through and make sure that you understand what's happening for the next year. The second part, really, I would say, budget. So you want to make sure that the plan that you choose is in your budget. So not just your monthly premium, if it has a monthly premium, but also things like co-pays, co-insurance, deductibles, prescription drug costs, co-pays or co-insurance or deductibles with your prescription drugs, and just really make sure that all still fits in your budget. The third thing I would say look at is what we call your provider network. So are your doctors, your hospitals, surgical facilities, those types of places still in network with your plan? Now, United Healthcare has the largest national network of providers. We have over 1 million contracted providers all across the United States. So if you are to go outside the state and if you happen to see one of our contracted providers outside the area in another state, it's just like you're at home in network with your plan. Wow. So it works very well. And then, the formulary. So any prescription drugs that you're currently taking, you really want to make sure you dig in. Most plans have a website that you can go in and put in all your prescription drugs, make sure they're covered, make sure you truly understand what is that prescription drug going to cost you. Is there a deductible? Is there a copay, a set copay, or is there co-insurance, which means it's a percentage of the cost? And then lastly, are there other benefits besides the medical benefits that are of interest to you? Do the plans have dental? Do they have vision coverage? Do they have hearing? And things like, free gym memberships all across the country. So those are the key points that I would suggest you really look at when you're choosing a new plan.
Todd, you've already given a lot of great advice, but do you have anything else that you want to add?
I would just say really dive into your plans and really look at all of your options. So, not just all the co-payments and where you can use the insurance, but is your plan still available in this area next year? And is it still going to work for you? And it's all about the small details. So make sure you get in and really look at the details this year.
Okay. Lastly, give some information on resources where people can look into it like you're suggesting.
Yeah, so there's lots of great resources available out there right now, but we're excited to be in studio today, and we've got a panel of local agents here ready to take your phone call at the number here listed on the screen, and they would love to help you right now.
Excellent. Thanks so much.